Welcome back. It's 8:41 and April is National Counselor Awareness Month. And joining me now live in studio to talk about the opioid crisis in Wisconsin and the country that is currently facing is Amanda De Leon with Community Medical Services. Thanks so much for being here, Amanda.
Thanks for having me.
So we want to talk about Community Medical Services. It's an addiction treatment center in Waukesha, but you guys focus on treating the whole person, not just the opioid addiction. So can you kind of tell us what that means?
Yes, so what treating by the whole person is giving them medication and counseling. As you said, it's April is Counseling Awareness Month, so counseling gets them where they need to be in their recovery. Medication, it only takes that edge off.
Okay, and so what is the importance of having that counseling aspect with the medication?
The counseling gets them to work at that deep-rooted issue of why they continue to use, or all of the stuff that led them to their use, or the things that they may have done while they were using.
Okay, and can you talk a little bit about this month being Counseling Awareness Month? What does that mean for you guys at Community Medical Services?
It means a lot. It shows that, our counselors are key to an individual's recovery. If our counselors aren't there to help guide them and to be that support system for them, then they wouldn't know what it's like to live, beyond drug use. So we value our counselors. We wouldn't be able to do what we're doing today if we didn't have our staff there every single day, devoted, with no judgment, with no shame, just willing to help somebody no matter what.
And for people who, may be experiencing addiction right now, or they have loved ones that are battling addiction, what is some advice that you would share?
I would say just walk into a treatment center. Just walk into anywhere for somebody who's struggling with opioid use disorder. You are worthy of life. You are worthy of being saved. And come to us. Come to any treatment center. I can say come to us because I can tell you we are going to greet you with open arms, with no judgment, no shame, and we're going to get you the services that you need.
And is it often that first step that's the most difficult to take?
Oh yeah. I mean, think about the first step that you take with anything, going to your first job, saying that, oh, I want to get healthy again, and walking into the gym and all the shame, like, how do I look? What is this going to do? How do I use this? How do I do that? Addiction is the same.
For sure. Yeah. And so how can people find out more if they're watching this interview right now, find out more of the services you guys provide in Waukesha?
Yeah, they can go right onto our website, communitymedicalservices.org. They will find all the information that we're about. We're medications for opioid use disorders, so folks will have the option of the 3 FDA-approved medications, which is methadone, buprenorphine products, and Vivitrol. And then they're able to see testimonials of our patients on how well treatment has worked for them. And they get to see all the great work we're doing in the community too. We have everything on there, from news articles to pictures. It's a pretty good website.
Wonderful. That's great information for people that are in need. So we really appreciate your time. Thank you so much for joining us in studio. And